Lumbar radiculopathy is the condition in which one or more of the nerves in the low back is compressed or pinched, causing pain that radiates into one of the legs. The spinal cord ends in the upper portion of the lumbar spine, which makes up the lower back. From there, a number of nerves travel to the legs in the central canal and then exit at various levels through channels that we call foramen. Anything that takes up space either in that central canal or in the foramen have the potential to encroach on one or more of those nerves. One of the most common causes is a herniated disc, but other causes can be things like cysts coming off of joints in the spine, thickened ligaments, and sometimes it can be related to being born with a narrow canal to begin with, something that we know is called congenital stenosis. Patients may or may not have back pain associated with lumbar radiculopathy, but by definition, there's pain somewhere in the legs or in the buttock, groin, or pelvis. This pain is often described as sharp, electric-like, stabbing, and can be associated with numbness or even weakness. There are certain physical exam findings that can suggest to your physician that your pain could be due to a pinched nerve, and it may prompt x-rays and possibly an MRI. Your doctor will also pay close attention to whether or not there is associated weakness in the muscles that the nerve innervates or feeds, as this can suggest significant compression. When I see a patient where the exam and imaging such as the MRI revealed that the symptoms are coming from a herniated disc or other focal area of nerve compression, I often prescribe anti-inflammatory medications or specific injections which can target the area of compression in hopes of decreasing the inflammation and swelling around the nerve. In most cases, these conservative options are successful in treating the problem. Physical therapy is also often prescribed anytime there is a problem with the low back, as this helps to strengthen the core muscles and acts to support that area. However, when there's notable weakness or severe pain, especially when it doesn't respond appropriately to the injections, you may be a candidate for a surgery to take the pressure off of the compressed nerve, which is considered a very predictable option for improving the pain. This is one of the most common conditions that I treat. Fortunately, in a majority of cases of radiculopathy, there are minimally invasive surgical options that can quickly alleviate your pain and get you back to your life and the things you love with minimal recovery time. While the symptoms you're experiencing can seem severe, and the prospect of spine surgery can certainly be intimidating, if you're experiencing lumbar radiculopathy, I can tell you there is hope and the condition is treatable.